Soft tissue injuries are common and can be quite painful to live with while they heal. Even with the right treatment, these injuries may need time to recover fully. In this video, I'll be discussing what causes a soft tissue injury, particularly in the knees, and how they can be treated. I'm Mr. Rahul Bhattacharyya, a consultant orthopaedic knee surgeon at Rahul Hospital in Glasgow, part of the Circle Health Group. I have many years of experience with diagnosing and treating issues troubling the knees, particularly sports knee injuries. So, what is a soft tissue injury? A soft tissue injury happens when the soft parts of your skeletal system, such as your muscles, tendons, or ligaments, become damaged due to factors like a traumatic event or consistent overuse. The most common locations for soft tissue injuries are usually the ankles, the knees, wrists, back, shoulders, and elbows. What are the symptoms of a soft tissue injury? Different types of soft tissue injuries have specific symptoms, but generally signs of a soft tissue injury are pain, swelling, bruising, weakness, and limited movement in the affected area. Taking part in activities such as kneeling, twisting around, squatting, running, and using stairs can often aggravate symptoms. Are there different types of soft tissue injuries? Soft tissue injuries mainly fall into two categories: acute and overuse. Acute soft tissue injuries are caused by a sudden traumatic event such as a fall, a twist, or a blow to the area. These types of injury include sprains, strains, and contusions, also known as bruises. Overuse injuries typically happen because of a repetitive motion that causes gradual damage over time. Examples of this type include tendonitis and bursitis. But what can cause soft tissue injuries? The major causes of soft tissue injury are either because of repetitive strain from overuse or trauma from sudden impact or forceful movements. People often get soft tissue injuries while taking part in sports and exercise. However, soft tissue injuries can also happen during everyday activities, general accidents, and workplace tasks. What is the best treatment for a soft tissue injury? Treatment will depend on the severity of the injury, the type of injury, and the type of joint, muscle, or limb affected. We may initially suggest applying the Rice method. If your knees have been impacted, for example, this would involve resting your knee to avoid further strain, applying ice periodically to reduce swelling and pain, using compression such as bandages or a brace to control swelling, and elevating your knee to decrease swelling. If this doesn't help, we may try other ways to help elevate the pain and heal the affected area. Perhaps medication, which could be over-the-counter pain relievers such as paracetamol or ibuprofen, or if the injury is more severe, we may prescribe stronger pain medication or anti-inflammatory drugs to help manage the pain. Physiotherapy is also effective. It involves exercises to help improve your strength, flexibility, and mobility to help you move normally again and prevent re-injury. Braces or supports may be used to help keep the affected area stabilized during healing. Crutches might be recommended to help reduce weight bearing on the injured knee. Corticosteroid injections may also be recommended to help control pain and swelling that has not responded to anti-inflammatory medication. Lastly, surgery might be needed depending on how much of the muscles, tendons, or ligaments have torn and how severe it is. This can help repair what has been damaged, especially if other treatments are not effective. What are the most common soft tissue injuries in the knees? The most common soft tissue injuries in the knees are injuries to your meniscus and to the ligaments, in particular the ACL. The meniscus is like the shock absorber in your knee that helps redistribute the load across your knee. If it is torn, it can cause you pain and clicking and catching in your knee. Preserving the meniscus is very important wherever possible. Not all meniscal tears require surgery. However, when surgery is required, there are various techniques now available that allow the surgeon to repair your meniscus and preserve it rather than taking it out, thereby reducing future chances of arthritis in your knee. An ACL tear is another common soft tissue injury to the knee. It happens most often in people playing pivoting sports such as football, netball, skiing, or hockey. It is an important ligament that supports the knee stability, particularly if you're keen to play pivoting sport. Severe tears will require surgery to fix them. Not all ACL or meniscal injuries require surgical treatment. It is important to see an expert to decide what is the best course of management. So that's a brief guide to soft tissue injuries and how to treat them. Thank you for watching this video. If you have any more questions, feel free to leave them in the comment section below and we'll get back to you. If you would like to arrange a consultation with me or another consultant in your local area to discuss your condition and potential treatment in more detail, you can book an appointment at circlehealthgroup.co.uk.